But my philosophy, I think you've gotten the idea that it's all connected, and that you can't speak about physical health without considering your oral health. It's not the centerpiece, but it's a big part of the entire picture. So it is a part of the discussion. When you look at, for example, the basic problems that people have with their mouth. They have cavities are one, and the second is gum disease. So those two things, and there are stages. So you could have a simple little cavity. You could have simple gum disease like gingivitis. But as they progress, the bacterial load is greater. And people have to understand that is not only affecting their mouth, but it's affecting their body. So it's a part of the conversation. If you really consider it, the mouth is like it's like the gate control of the body. It's like going to the airport and having to go through security. Everything that enters our body comes through the mouth, and the mouth has a job that's crazy. I don't know if you knew it, but there are over 700 different types of bacteria that reside in the mouth. 700 different types, and at any one time, if you count individual bacterium, can be up to 20 billion with a B bugs living in your mouth. My mouth, your mouth, everyone's mouth. So the mouth has a job of preventing all that junk from entering our bodies. And when things go wrong, it's a gateway into the body. And that's why there's a very strong connection between oral health and whole body health.
Is something standing between you and your happiness? It was for me. I had to face my depression and the constant negative self-talk. Therapy helped me realize I deserve to be happy. That's why this podcast is called I Choose Health, because I made the choice to heal, and I want to share that with you. As a gift to you, we've partnered with BetterHelp as our sponsor to help you start your own healing journey. We all face moments when life feels overwhelming, whether it's stress, anxiety, or just feeling stuck. Talking to someone can make a real difference. And that's where our sponsor BetterHelp comes in. BetterHelp offers professional online therapy that's convenient, affordable, and entirely on your schedule. You can connect with a licensed therapist by video, phone, or even chat, whatever works best for you. Let our sponsor BetterHelp support you on your journey to better mental health. You can get 10% off your first month by going to betterhelp.com/iChooseHealth. That's betterhelp.com/iChooseHealth for 10% off your first month. Take the first step toward feeling better today.
As a teenager, I decided to live better, so I gave up the meat, eggs, and cheddar. At 20 and 30, I wanted more, so I strengthened my mind and my core. Living a life that is healthier and wealthier because I choose health.
I want you to know that whatever you think you know about oral health or dental health, you might be wrong, right? Depending on how well read you are on certain things. And so I want to invite our guest today, who is quite, I would say, pioneer in his field in terms of going into imaging and all the work that he's done as a dentist over the years. And I want us to go a little bit deeper into oral health and your overall health in terms of the rest of your body. And with me today is Dr. Eugene Antenucci. And I don't know if I'm pronouncing that correctly.
Antenucci, yes. You got it.
Antenucci. There we go. Okay. Well, Dr. Antenucci, welcome to the I Choose Health podcast.
Thank you. Pleasure to be here.
Definitely. So I wanted to go a little bit deeper because I remember years ago, I was having a discussion with a friend, and, they stated that depending on one's oral health, it could have an impact on their heart health and health overall. And at the time, it didn't seem to make sense to me. I didn't fully understand what they were saying. But I would love you to break down how that oral health could impact your health overall. So let's break that down for our audience.
Sure. Because when people think of dentistry, they think of fixing a broken tooth. They think of a cavity and things of that nature. If you really consider it, the mouth is like it's like the gate control of the body. It's like going to the airport and having to go through security. Everything that enters our body comes through the mouth. And the mouth has a job that's crazy. I don't know if you knew it, but there are over 700 different types of bacteria that reside in the mouth. 700 different types, and at any one time, if you count individual bacterium, there's can be up to 20 billion with a B bugs living in your mouth. My mouth, your mouth, everyone's mouth. So the mouth has a job of preventing all that junk from entering our bodies. And when things go wrong, it's a gateway into the body. And that's why there's a very strong connection between oral health and whole body health. So that's just setting the table for understanding. So when we have problems like gum disease, where there's a little bit of inflammation, like gingivitis, which is a soreness of the gums, happens because of bacteria, can happen because of other reasons, that becomes an entryway for those germs that reside in our mouth to go through our bodies. And our bodies now have a source of inflammation apart from wherever this stuff resides. So if it enters your bloodstream, it can go to the brain. There's a strong link. The studies just came out showing a very strong link between cognitive decline and dementia and oral disease, all different types of mouth disease and infections. There's a strong connection between, because they enter the bloodstream, they can reside in the heart, they affect blood pressure, they affect cardiac health, and there's a high correlation between having risk of and having actual heart attacks or coronary conditions with heart disease, with oral disease and oral problems. So those are just two very straightforward examples. But if you have the concept in mind that the bugs in the mouth should stay in the mouth, they don't belong in the rest of our body. If we swallow them, our gut knows what to do. But when our bodies aren't healthy because we have metabolic disease, like we have diabetes, if we're obese and other systems are breaking down, if we have pulmonary disease, you name it, then there's problems because then our body can't fight what it normally or what it's designed to fight.
With all of the with the knowledge of all the bacteria, as you stated, that exists in the mouth at any given time, I imagine, not just from day-to-day eating, but from exposure to other things. And I'm thinking about your book, Lasting Fasting, right? The Intermittent Fasting Pathway to Permanent Weight Loss, Looking Great and Feeling Great. Has there been any research on the impact of intermittent fasting on better oral health?
Not that I'm aware of. As I think through it, what would be an effect, and I'm conjecturing this, I'm thinking this through, but when you have a lesser load of sugars, which are really the food for the bacteria that are in our mouth, are the sugars and the byproducts of the sugars that we ingest. So when when you're fasting, and I myself regularly go through a 12 to 16 hour fast. So I don't eat, and I won't be eating today until 1 o'clock. I don't have the carbohydrates entering into my mouth, into the system. So it would make sense that there's a lesser load. But that's a very good point. It's something I will look into. But if you keep that in mind, when it's the carbohydrate load that or overload that we have, that is food for the bacteria. So you eat less, or you eat properly, or you eat with intention, reducing the processed carbohydrates. You're not feeding the bugs that are in your mouth that could do damage.
I was kind of interested just looking at that book because, being that you are working in dentistry, I know some people may be wondering where's the connection between that and you writing a book on weight loss and feeling great, right? And, go into that because you were talking about the carbohydrate uptake or the increase in carbohydrates. Do you think that because the way that, especially in the West, where there's an overemphasis on processed foods, is that possibly the reason why there's always a lot of our foods, a lot of our, whether it's breakfast, lunch, dinner, there's some type of carbohydrate? Is that the reason why? I'm just curious about that.
Well, the amount of carbs that we in our society take in and the types of carbs it's mind-boggling. I've been on this journey for a good period of time with probably over 12, 15 years now that I've really looked at my health and made some major changes, and I've been able to maintain that. But I really have examined the the foods that I eat personally, and I'm very, very sensitive to it now, where I don't even like sweets any longer because it's not only that it's not healthy, but it's not appealing to me any longer. The amount of carbs, the types of carbs that the American diet is centered on are detrimental to our health. And you could see that if you look at the American society over the past from the 60s on, if you look at a picture of teens on the beach in the 70s and teens on the beach today, you have two totally different pictures because the diet has changed significantly towards a processed food diet, towards eating junk. I look in my staff room here I'm at LSU University. We have a staff room right next door to my room, and there is stuff there all the time, and it's not good stuff. There's candies, there's cakes, and that's what people eat, and everybody's on a diet. Everybody's obese. You talked about how did I, as a dentist, get into nutrition and all? I had patients who suffered from all sorts of metabolic diseases, and there was a commonality to it. There's obesity, diabetes. There's problems with, because of that, problems with being sedentary and not moving as much, and it's a big cycle. And I spent a lot of time counseling people, and so I figured, you know what, I really should know what I'm talking about. So I pursued a certification in nutrition and diet and fitness. And that was a part of my own personal journey towards this. So, and it's a realization that everything that we do in our bodies, it's not an isolated system. It's not the mouth. It's not a hand. It's not the heart. It's everything is working together. And I see that close and personal with people because I can tell when a patient comes into in my chair and I'm sitting and speaking to them, I can get a picture of them right away if their body mass is too large, if they are carrying too much extra weight. I have an inkling that they're probably suffering from hypertension, probably pre-diabetic or diabetic, and the whole list of metabolic diseases that are there. I can tell whether a person has issues with alcohol. You smell that on their breath. Whether they have a condition of diabetes, I could smell the remaining sugars on their breath. And you get a good picture of their overall health history, of their overall health condition at any point in time.
And, with with the interconnectivity of health for you, and I think I kind of grasp your concept and principle around it. But for you, what does health mean to you? Like being healthy mean to you?
Well, health health is it's not what our society points us to. It means you're
Mhm.
buffed and you're thin and all that. That's a part, maybe a part of health, but it's not what health is about. Health is mental. It's a big part of our health. We have to really be in love with ourselves, in love with what we're doing, and have the right attitude. It's people. It's being able to be surrounded by people and give to people and to take from people on a regular basis. It's what we eat is a big part of health, and it's how we move on
Mhm.
a daily basis. Those are the components of what I would say a healthy person is. So if you eat properly, and proper eating can mean all different things. It can mean you could be vegetarian or vegan and eat properly. You can eat some meat and eat properly. There are people who claim you can eat only meat
Mm.
and be healthy. My point of view is that we're here. We've developed our DNA is based on what our ancient ancestors ate, and they ate
Mhm.
meat proteins from meat. They ate carbohydrates that were not processed in the least. They were extremely, whole foods and more difficult for our bodies to process, but our bodies squeezed every bit of energy out of them. So that's really how I base my diet on. I base it
Mhm.
on whole foods. I source them properly because everything that I eat has ingested something, whether it's minerals from the soil that are good or bad, or whether it's a cow eating feed that's junk, that's all processed, that becomes a part of me. So I source my food. So my diet personally, for the nutritional part of it, is whole foods. It's smaller amounts of meat, larger amounts of vegetables of every color and shape, cooking them properly, using oils that are not processed oils. I use olive oil almost in everything, everywhere. And there are other oils that are excellent oils, like coconut oil. There are many different oils, but I stay away from seed oils because of their processing. And that's a big component of health. If you're eating properly, then you're setting your body up to do the right things. But it's not the only part of the equation, because you have to move. Our bodies were designed to move. Our ancient ancestors, our DNA is based on moving, on picking things up, on putting things down, on lifting, on stretching, on walking. And so I walk everywhere. I'm on the fifth floor of this building. I walk up and down the steps. I rarely take an elevator. If I'm in an airport, I walk up the escalator. I walk upstairs, and I just walk because it's an opportunity for me to move my body. I'm 68 years old, and I hope to be 78 and 88 and doing the same things. But movement is a big part of it. But that's not the only part of health also. You need people, and you need the mental state and the appreciation that you're not the only thing that exists in this world, that there's something greater than you are, and that you have to honor that.
Well, you're doing something right, by the way, because you look amazing. I didn't think you were 68.
Thank
So
you.
you're doing something right. So I'm also curious, because I know that you did work in the Air Force, working both as a captain and dentist.
Yes.
What did you discover about oral health, especially within the Air Force? Because I'm wondering what, their oral health and health look like with everything that they had to do, everything that they had to pay attention to. Sometimes in certain careers, you don't have a lot of time for self-care. So I'm just curious to know what you saw in your time there.
That's a good question. In the military, to be in the military, there's some screening that goes through. So if your mouth is a disaster, you have to fix that before you're brought into the military, or the problems that you have to be fixed. So a lot of the 18-year-old airmen and airwomen, the entry level people that I've dealt with, had all sorts of issues. They came from every part of the country, some from big cities, some from rural areas, and a lot of the mouths were not cared for properly, partially because their diets were not good, too much sugar, and the whole deal. So at that level, we did a lot of fixing stuff. We did a lot of extractions, we did a lot of fillings, and the basic dentistry. The military isn't really designed for, however, they do more advanced work like crowns to repair bigger problems on teeth. We did make dentures for people and things like that. My military service was in the 1983 to 86. So I'm very detached from what's happening today. At the time, we didn't do implants. They didn't exist really. They were just coming in. I don't imagine that that's a big part of dentistry in terms of the service. I know right now I've treated several Coast Guard who were in the U.S. Coast Guard, and they were paid. One of them had implants approved, the other didn't. So there were rules. So they do pay for some implant services for replacements of teeth. So there's a very well-trained dental staff. They're very highly skilled people. They were great docs, great people that I worked with at the time. And several of the professors that I teach with now are ex-military and the same caliber. So, and I have some students that have gone into the military. Just one that went into the Navy, just starting now, and she's a great student. She'll be a great naval officer. So there's on both sides of it, there's some good stuff, but it's well maintained population without the fancy dentistry. You're not going to get the veneers, and you're not going to get the beautiful smile. They're very functional work to keep you a fighting man or woman.
You've lived quite an extensive career, from working with the Air Force to being a professor at NYU as well. And then, as you said, you were also working as a health and wellness coach. As you're working with these particular clients, how many of them are aware of your dentistry background, and how often are you speaking to them about their dental or oral health as you're trying to help them with everything else?
I always they're all aware of my background. Many of people that I work with are through my practice, and right now I teach full time, but I also am practicing a full 8 hours a week. I practice, and I have a private practice here at school. So the people that I work with nutritionally, I counsel, I coach, are aware of me. But my philosophy, I think you've gotten the idea that it's all connected, and that you can't speak about physical health without considering your oral health. It's not the centerpiece, but it's a big part of the entire picture. So it is a part of the discussion. When you look at, you look at, for example, the basic problems that people have with their mouth. They have cavities are one, and the second is gum disease. So those two things, and there are stages. So you can have a simple little cavity, you could have simple gum disease like gingivitis, but as they progress, the bacterial load is greater, and people have to understand that is not only affecting their mouth, but it's affecting their body. So it's a part of the conversation.
I feel like when it comes to oral health, many of us have the assumption that, I just brush 2 times a day, I floss, I'm fine, right? Like, what else could be wrong? What are possible, like, oversights that people have when it comes to their oral health, right? Because, as we said, you might be just thinking about brushing and flossing, but what are areas or other things that they probably should be implementing to secure better oral health?
Well, it starts with things that we've spoken of already. The amount of processed carbs, highly processed carbs, sugars that we take into our body is one thing. There's nothing the matter with having sugar. There's nothing the matter with that. But in excess, it's wrong. But continued use of it, meaning if you're going to have a donut, have a donut, and then that's it. But don't be eating a donut every 10 minutes, eating a bite of one, because you're feeding the bugs all day long, and you don't want to do that. So the idea would be, first, watch what you eat, watch the frequency of what you eat, but then understand that that food, the residue of it stays in your mouth, and the bacteria are like this. They say, I can't wait to eat. And they start to metabolize that, and they grow, the colonies grow, and that's what plaque is. It just builds and builds and builds and builds. And here in the university, when I'm working with students, you don't want to see the stuff I see, because we have patients come in here, they haven't been to a dentist in 40 years, and they have stuff growing on their teeth that's disgusting. But overnight or an hour after you eat, these colonies, these bacteria are growing. They're building, they're growing, they're munching away, and their byproducts, because there is waste product from the sugars, is very acidic, and it's toxic to the gums, and it's toxic to the teeth. The acids bore into the teeth, they break away the enamel, they break away until they create a hole, and then that hole gets bigger and bigger. They go into the gums, and they cause the gums to be sore. So we have to clean it. So we clean it by brushing. So you brush in a very systematic way, you're going to get everything off. If I asked a child to wash a window that has 6 panes that are divided, they're going to go like, and they're not going to do a great job. But if you teach someone to clean each pane properly, just like cleaning each of the 16 teeth we have on the bottom and 16 on top, on the face surface, on the tongue surface, it's more than just a quick shoe shine, a quick brush like that. It's methodical brushing. It should take you about 2 minutes on average to brush. Half the time spent on the lower, a quarter of the time on the outside of the lower, quarter on the inside of the lower, top, inside, and you have 2 minutes of time. And that's why the toothbrushes that you get, like Oral-B or all those electric kind of brushes, have an actual timer that mine vibrates every 30 seconds. So I know that I've done 30 and 30, and that's just knowledge, that's just from studies and all. So brushing thoroughly, but that doesn't get in between the teeth, because the brush goes on the face and on the outside and on the inside. So you have to get something in between. And a piece of floss is a good tool. Some people find it difficult or tedious to use. So there are little toothpicks or little brushes that can go in between the teeth, and you have lots of spaces in between. So that has to be done because those are hiding places. Some people are proponents of things like oil pulling, which has a benefit. There are certain oils like coconut oil, which has lauric acid in it, and the acid breaks down the bacterial defenses, and then the oil sticks to that, and you spit it out, and it's gone. So coconut oil, olive oil, polyphenols are in olive oil. They do the same type of thing. They're antibacterial, and there are even benefits for ingesting that and for swallowing that. So cleaning your tongue. Your tongue is coated with these little, they look like fingers that are waving in the breeze. They're villi, and they look like mountains and valleys. And under a microscope, they're gigantic, and there's a ton of them. You don't really see them unless a person smokes a lot or a person has fungus infections or different things. Then it gets funky colored and longer. But those villi trap bacteria. So a tongue scraper is a good habit to do on a daily basis. So a tongue scraper is used to, I don't know if you've ever seen or done it, but it's actually a device that is it's kind of like a rake and just goes from the back of the tongue to the front. You spit out the junk, and there's a lot of stuff in there. So that's reducing bacterial load. And those things will go a long way. Watch what you put into your mouth and then properly cleanse it like you're cleansed, like you know that you have a multi-sided thing that you have to clean. And there are many of those things in your mouth. You have up to 32 teeth is what we're born with. Not everybody has them all in their mouth, but that there's a good number, there's 28 to 32 teeth that you're going to find in your mouth. So they have to all be cleaned.
As you were talking about different like cleaning techniques, I was thinking about the oil pulling. I remember I was introduced to that by a sister in our church. The process though just seems so tedious because I think there are different like certain windows of time. I think some people do it for like 12 minutes, some people do it for 20 minutes. Right? It
Yeah.
just seemed like such a tedious task. But there's that. I believe also with like hydrogen peroxide, there's like oral debriding. I don't know if I'm understanding that correctly. I don't even know if I understand the definition of that. But with all these different techniques, do you think that there should be one that's preferred over the other? There should be a combination of these techniques, or just a consistent monitoring of your oral health?
There's no magic thing to do. It's if you understand the principles, the principle is you have up to 700 bacteria in your mouth that will get out of control if you don't take care of yourself. And if you feed them the wrong stuff, they're going to get out of control. So you have to remove it. The best time to remove it is after you eat. So the normal person, the average person gets up in the morning, they have this gross taste in their mouth because their mouth has been dry and the bacteria are kind of festering in there. So they brush right away. But then they eat breakfast and they don't brush again till they go to bed at night. So they have at least 12 hours or more of bacteria in the mouth. So if you can get into the habit of brushing after breakfast, after lunch, and after dinner, everybody you can buy a little toothbrush that folds into itself and a little thing of toothpaste, keep it in your desk at work. After you eat lunch, just go to the bathroom and brush. If you can brush after breakfast, a lot of people are rushing around and everything's too hectic. Brush at work, or at lunchtime is better than after dinner. But if you have it in mind to brush after your meals, you're removing the heavy debris that gets broken down into plaque. Then the other part of the story is regardless of how well you brush, you need to see a dental professional to clean the tartar or material that calcifies. It's kind of like barnacles on the side of a boat. They get stuck to the teeth, and I don't care how well you brush, you have to remove it. Some people grow tartar or it calcifies slowly, and so every 6 months is good. Some people every 3 months they need to get it cleaned. It depends on your body's chemistry and metabolism and your diet also.
I was looking over one of your books, and I think it was called Eat Like a Tuscan. And I know you were mentioning the olive oil, and I know a lot of people speak about the Italian diet and especially like the Mediterranean diet overall. What have you found about that diet as it compares to particularly the West? When I say West, I'm speaking more like America and that side.
Well,
What have you found have been the benefits of eating like that?
I grew up. My dad was born in Italy, and I grew up with an Italian culture. So it's all been very normal to me. The vegetables and everything like that. My diet was very much centered on that. But along my journey
Mhm.
of health, I did a lot of studying on the blue zones, on areas of the world, and
Mm.
that have more people living over 100 than anywhere else. And Greece and Italy are Mediterranean countries in the blue zones. There's also a South American country, and there's also in Japan a blue zone, and there's also an area in California that's a blue zone. But the looking at the diets of Greece and Italy, they're very much the same, similar, following what's known as what's been termed the Mediterranean diet. The Mediterranean diet is a diet that is whole foods, complex carbohydrates, lots of vegetables really at every meal. And the vegetables are filled with color because with the colors are different chemicals that feed our bodies, different vitamins and minerals and all of that. So there's always been a variety in my diet, and the Italian diet is a very vegetable centric heavy diet. The Italian diet, and that's as opposed to the American diet, because you look at kids today, I don't know if you have kids or if you have nieces and nephews, what do they eat? They want chicken nuggets, they want chicken fingers, they want pizza, they want, and there's not a vegetable to be seen. I was forced to eat vegetable, and now I love them. I love everything that I hated as a child. I've become a part of me because it was a part of my culture. Our culture doesn't teach that or give that. So, and then what do we substitute? We substitute lots of meat. And again, I'm not anti-meat, but I'm sure that meat isn't sourced properly. The meat is filled with hormones. It's filled with feed that's antibiotics and all sorts of stuff that's gone into that animal. The chicken nuggets are probably processed and reprocessed and mashed and put back together and reconstituted with all sorts of chemicals. Those chemicals are bad for our guts. So that's not in the Mediterranean diet. Mediterranean diet uses olive oil I mean, that's their oil and so many health benefits. Mediterranean diet, so it's low amounts of meat. There's coffee as a part of the Italian culture. Wine is a part of the Italian culture. In the blue zone countries, there's alcohol in moderation, but it's not, except for one of the blue zone areas, which is Loma Linda, California, a religious community that doesn't do any alcohol or anything like that. But 4 of the 5, alcohol is a part of it. So I have no problem with moderate alcohol. I have a couple of glasses of wine a day, a night, and I'm fine with that. So, and there's chemistry in in the wine also that's known to be beneficial. And there's some controversy regarding that. But that is the essence of the Mediterranean diet. It's whole foods, not processed, more vegetables and meat, and cooked properly. You could cook the heck out of food where you get rid of all the nutrients, which doesn't do you any good.
Interesting because I've had the best of both worlds in the sense of when you spoke about Loma Linda. I didn't grow up in Loma Linda, but I grew up Seventh-day Adventist, so I understand how that particular community, how we were, taught how to eat and how to take care of our
Yes.
body and to follow those particular principles of health. And additionally, as well, I'm originally from Barbados in the Caribbean, and so growing up in Barbados, we typically tended to eat more produce, more veggies, more fruits than anything. And
Hmm.
so at one point, I think it was Barbados and Japan that had the longest living people at one point. So we would have a lot of centenarians, and it's actually celebrated. The governor general in our country would actually visit a centenarian on their
Really?
birthday and
That's
celebrate
cool.
them. So that was something that would happen. And I mean, you can do that in a country that has 300,000 people, right? But that was, my experience with holistic health growing up. Growing up Adventist, growing up in Barbados, and so those are principles that I've learned from both things to try to keep. And then also, there's something that I definitely want to pass on to my daughter as well. And,
Yes.
she's only 2 right now, but I want her to come up valuing holistic health and just eating the right way so that, she can have a long and healthy life. So that's just been, it's really interesting that you brought that up.
And then pass that on to her children. And that's the way it works, right?
Yeah. 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 And I wonder as well, because I know I was doing some research on the amount of hours of nutrition that most medical doctors, take time studying. And I think the number is somewhere around 20. When it comes to like your dental counterparts, do you feel like the majority of them have the holistic perspective on health and oral health, kind of in the same way that you do?
No, it's unfortunate, but it's not a part of our training either. It is the training that we have is about sugars and decay, sugars and dental disease, things like that. And I've actually just had us ready to begin a study of dental students' health and their perceptions of health with the same idea in mind, that I really want to bring this message into starting here, but to dental students and to, medical schools are getting, maybe some of them are getting on the bandwagon and doing a little better with nutritional information, but not nowhere near the degree that it should be. No, and it's unfortunate because it is the foundation of health. It's a foundation.
Yeah, yeah, and I'm looking forward to the results of that study because I really love the fact that you have taken upon yourself to go deeper because I think in terms of like the medical industry, I feel like dentists may almost have that ability to kind of like cater to people more than anything. Like, hey, don't eat these sugars, don't do this, don't do that. Versus like, saying like you should probably look at your health holistically on the whole.
Well,
And
I
so I think it's yeah.
I just wrote a book. I just recently self-published it. It's called "The Hidden Inflammation You Can't See," and it's talking about the mouth, the oral, of whole health connection. But it's designed. I wrote it for physicians to share with their patients and to collaborate with dentists because there is not
Mhm,
everything's just so segmented. Everybody's in a silo. So you have the cardiologist
mhm,
and you have the urologist and you have the psychiatrist, but they're all doing their own different things and they don't cross. So we know that inflammation is the source of so many of our problems, and inflammation is detrimental to us because there's a cycle that occurs, and if it's not put out, if the inflammation isn't eradicated, then our bodies suffer from it, whether they suffer from fatigue or they suffer from disease that occurs or cells that go crazy and cancers. And it what it comes what it comes down to, though, is just understanding the principles of what we're dealing with.
mhm,
And if you have that in your mind, you understand what you're doing, then you can approach it from health. Medicine is really looking at different aspects. It's siloed, and I find that my medical colleagues don't really pay the attention that they need to pay
mhm,
to this, that it deserves, because they're dealing with patients that have, maybe they're coming over some disease or have dealt with something, but their patients they plateau and they never
mhm,
really are free of their issues. And a big problem is that there's always the 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 chance of upstream inflammation, and the mouth is the biggest source of inflammation that's apart from whatever disease that a physician may be trying to fix or to deal with.
mhm.
So if the mouth is healthy, then you're giving your body, you're checking that off the list as something that's causing your other problems. So it's a big consideration. It's a big concern, and it's something that needs to be taken into account. So my medical colleagues, as well as my dental colleagues, need to look at that. When I see a patient, I'm looking at I'm looking at all of this as a part of fixing their tooth or teeth, or doing their implants or whatever it is that they need
Mm,
to have done.
yes. Well, Dr. Antonucci, I'm gonna close out here, but I want to have you back for sure because
Oh, sure.
yeah, I think that this is vital information, and as I said before. Okay, I feel like our oral health is something that we don't focus enough on. And I think that, the work that you've done has really helped open the eyes of a lot of people to being more aware of how they're eating, how they're living, just the whole interconnectivity of health. I want to just take a little bit of time to just promote your most recent book. And, I know obviously we want people to come away with their own understanding, but what are some things that you think that people should really glean from your newest work?
Well, the book that I just mentioned now is just it's more of a pamphlet, but what to glean from that is to have a full understanding of the inflammation that is in your mouth, that can be in your mouth, and how to get rid of that so that you give your body a chance to be healthy. So that's the hidden inflammation that you can't see is the name of that. You can find that on Amazon. It's it's an ebook and it's also in a paperback version. I have 3 books coming out as a bundle by Brick Tower Press in New York City, and they will be June 15th is the date, and they go through 3 aspects of health. One, I look at my Italian culture and what I've gleaned from that and how I sort of emulate Italy as being a very healthy country when it comes
Hmm.
to having so many people over 100 years old. Why is that? Why do they have less cancers and things like that? So that's the first of the 3. The second is to look at what you need to do, what I need to do on a daily basis to be healthy, and looking at the pillars of health, which are nutrition, movement, other people,
Hmm.
and purpose in life. And then the third book in the series is called what it looks at is it looks at our longevity from a scientific standpoint, and it is explores that and gives a very scientific basis for that. So it's called The Forever Human, and that
Hmm.
book is a part of the 3. So I look to give an understanding of what everybody can do, what you need to incorporate as a whole in your life, and then to have the nitty-gritty understanding if you want to get the technical aspect of what's involved with being healthy and longevity. So that's coming out. Those 3 books are coming out as a longevity series coming out in mid-July, about a month from now.
Well, I'm really excited for those works and, for your newest book as well. And again, for my audience, this is Stefan just reminding you that choosing health is about choosing power, possibility, and purpose.